Hi everyone, how are you? Welcome to another question and answer session for MRCS exam. Here the question, first of all, read the question very carefully. A patient present with superior vena cava obstruction, how many collateral circulation exists as alternative pathway of venous return? So here for the key point, we can see here the patient present with superior vena cava obstruction. That means the vena cava is obstructed some of its points. How many collateral circulation exists as a alternative pathway of the venous return? So now we have to find out the alternative pathway to which the blood of the upper limb and head neck area will drain into the heart by passing the superior vena cava. Here the options. The options are there: none, 1, 2, 3, and 4. So let's see some of the picture regarding this question. So here we can see this is the superior vena cava. It is formed by the two brachiocephalic vein, right and left, and here now we know that the superior vena cava, it drains into the heart. Here imagine this is the heart and the inferior vena cava drain in the heart. So through this normal pathway it occurs, but when there is obstruction what occur, this is IBC, suppose here the obstruction. So by which the blood comes to the heart. So here we can see the blood is come up to here from the right and left brachiocephalic vein, and this brachiocephalic vein, they drains blood from the head neck area and from the upper limb area. So they have to bypass and they ultimately get into the heart. So first of all we can see the azygous venous system. So first of all, azygous venous system, it's can now backflow and they back and they drain into the inferior vena cava, and followed by they drain into the heart. And we can see there is another two vessel here. This is the here left internal mammary vein, and in the right side there is right internal mammary vein. So they also backflow and blood gets backward and it drains into this vein, that is the external iliac vein. And external iliac vein, from the external iliac vein they drain into the common iliac vein, then inferior vena cava, and finally from the inferior vena cava they drain into the heart. And we also can see some other vessels such as here the lateral thoracic vein, here just outer side of the internal mammary vein. So from the lateral thoracic vein the blood here also backflow and it goes back, and here we can see they drain into the great saphenous vein and femoral vein, and finally from the femoral vein they drain into the external iliac and common iliac, then inferior vena cava, and from there it drains into the heart, in which here heart usually lies at this position. So if any obstruction in the superior vena cava, then blood drains to the lower part and it gets the inferior vena cava, and through the inferior vena cava it reaches to the heart. So here you can see there are four collateral venous system. They are first of all azygous venous system, then internal mammary venous pathway, then long thoracic vein system with connection to the femoral vein and the vertebral vein. Here the two pathways. So in the third option there is two pathways, and in above azygous venous system and internal mammary venous pathway, the two systems. So 2 and 2, 4. So total 4 collateral venous system are present in case of the collateral circulation during superior vena cava obstruction. So here we can see there are four alternative pathway through which the venous return occurred to the heart due to obstruction of the superior vena cava. Thank you all.